right, good morning or good afternoon, depending on where you are in the state. Thanks so much for being with us today. We're going to start you all off by putting your name, organization, and county in the chat. So let's get this thing going. Again, welcome. We're so excited that you are here today. As a reminder, this briefing will be recorded and sent to you all later on in the week. We will have time for Q&A, which I'll send the instructions as we go on. So if you have any questions that pop up, please make sure that you put them in the Q&A box at the bottom of your screen. And then, as I said before, please introduce yourself by putting your name, your organization if you are with one, and the county that you are in the chat. So as a reminder as well, these briefings we have switched back to weekly. So the next one will be December 10th. And also I do want to preface, I am looking at a different screen. So if I'm looking back and forth, that is why. And again, it will be recorded and then sent to you all later this week. So our speakers for today are myself, Danielle Branch, the Health Policy and Advocacy Associate, Jane Denwobi, who's speaking on our health policy, and she's a staff attorney, and then Signe Anderson, who's our Senior Director of Nutrition Advocacy. She'll be speaking on all things anti-hunger. So as a disclaimer, the Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. All right, we can go ahead and shift things over to Signe.
Hi, everybody. Thanks for being here today. We can go ahead and go to the next slide. I just wanted to give folks a quick overview of some of the things that I wanted to cover today. I want to just make sure everybody's aware of where SNAP stands post-shutdown. There's been a lot of misinformation coming out from the Secretary of Agriculture, so I wanted to address some of that. Also, the major thing that we've been dealing with, and part of the reason why we brought these calls together to begin with was to address the threats to SNAP and coming out of budget reconciliation HR1 and the passage of the bill in July. There's a lot that continues to move forward regarding the SNAP cuts, and so we'll dig into that a little bit about the work requirements, immigrant access to SNAP, and the state cost share. And then finally, I think it's really important to flag the summer EBT program in Tennessee. We are quickly approaching another deadline for the state to decide to participate in 2026. So those are the highlights that I want to share today. All right, we can go to the next slide. All right, so SNAP post-shutdown. If you joined us for the last call, much of this we elevated, but there were still some things that were up in the air. USDA's budget for 2026 was approved. So for all things related to food aid, funding has been set aside and agreed upon for 2026. So that means in January, as they continue to discuss the fiscal year 2026 budget, SNAP and WIC have already been decided. So that's no longer part of those negotiations. In Tennessee, the last time we spoke, we were still waiting for some families to receive their benefits. November benefits have all been sent out. The disbursement and pushing out of those benefits was a challenge. We saw delays even beyond November 20th when most families were expected to receive the benefits, but the benefits did ultimately get out to families. There's a lot of confusion amongst caseworkers about what was happening in those last couple weeks of November. But a lot of that has been ironed out now that benefits are returning to the normal schedule. December, families should see their SNAP benefits come through at the normal schedule. So we will continue to watch that and make sure that any of the fallout from the shutdown isn't impacting our families. The one thing or two things I think are important to flag is Even though we've resolved the funding piece, the delay to SNAP has short-term as well as long-term effects for low-income families, and we continue to hear from families who've been impacted by not having that benefit that they rely on the date that they normally expected. So families continue to feel that burden. And then the other piece to this is because of the chaos of the shutdown, we anticipate that the state error rate will be impacted, and there are some efforts to lift that up and to be talking with the federal government about being a bit lenient about the error rate moving forward, and we'll get into that in future slides. The next slide. All right. Yeah, again, the other thing that I wanted to flag, because this keeps popping up, there's been a lot of information pushed out from the Agriculture Secretary, Brooke Rollins. Initially, there were some things that she was saying about the SNAP application process that was coming from a place, I think, of misinformation and misunderstanding, as well as potentially some malice. But the SNAP application process continues to move forward as normal. If families have applied for SNAP, they should continue to receive those benefits. There is a system, a very regulated system in place already. Families have to recertify. Most families have to recertify every 6 months, and there's a lot of checking in that has to be done. And so that initial talking point from Brooke Rollins should not impact families. SNAP application process should move forward as normal. The other piece that keeps popping up is talking about rooting out fraud. But again, I think that's coming from misinformation and just a wrong a wrong approach to this. Up until December of last year, December 2024, there was a lot of effort to make sure that families who had fallen victim to skimming, which is something that's been impacting families since the middle of the pandemic, where criminal rings are stealing SNAP benefits from low-income families. That's been the major impact that we have seen to the SNAP program. And there were efforts to address the SNAP card and make sure that the SNAP card is updated to chip card technology, as well as reimbursing families. At the beginning of this year, 11,000 Tennessee families had benefits stolen from them. And that's really where the major problem exists, is that low-income families being taken advantage of. And that's where we think Congress and legislators on both local and federal level should be focusing their attention on making sure that low-income families are protected and these crimes aren't being committed against them without any repercussions. Again, families were supported and reimbursed up until December of 2024, but Congress reversed course, and these families are no longer being protected. For many of us on the call, if our credit cards are compromised, if our bank information is compromised, we see that money come back to us. For SNAP families who rely on those benefits to feed their families, if they're stolen, there's nothing done for them as of December of last year to help reinstate those benefits. And that's really the true problem here that the federal government and the state should be looking at. There's also been a lot of partisan singling out of states and threatening of benefits for people, especially in blue states. I think we've flagged some of the data requests made by the federal government, by the Trump administration and USDA to dig into people's data who participate in the SNAP program. And there are several lawsuits right now that are out there. And until those are resolved, USDA should and the administration should leave that alone and shouldn't be threatening people in states of their benefits because of this. So those are some of the things that have been popping up from USDA and specifically from the Secretary of Agriculture, Brooke Rollins, that we wanted to set the record straight on, and we'll continue to just try to root out the misinformation that's coming out about the programs. We can go to the next slide. All right. So again, kind of the root of these calls was really addressing some of the SNAP cuts that we saw coming out of this administration in July under HR 1. There were many cuts that came forward. Some of them were going into effect in October, but because of the shutdown, we have seen some relief, but not as much as needed. State agencies and legislators have asked for more time to implement some of the rules, given the shutdown disruption and the incomplete guidance from USDA. Work requirements is one of the very few areas where they've allowed an additional month for people to be able to not have to meet the work requirements. So instead of 3 months, we have an additional fourth month that people can work with when it comes to the work requirement. The other area that has popped up in the middle of the shutdown was there was finally guidance released on immigrant households access to SNAP. As we've shared in past briefings, the majority of immigrants who were able to access SNAP prior to this bill, and it was a very, very, very slim number of immigrant families who could participate in the SNAP program. But it always protected immigrants and asylees. Those groups have been taken out and are not eligible unless they are Cuban, Haitian entrants, and there are other few very limited groups of people that are protected. So immigrant households are now losing access to SNAP, and the guidance released on October 31st makes it less possible for families to participate. And we're watching that guidance to make sure that that the very few people that are still eligible remain eligible and can continue to receive their benefits. So we'll share more information out on that as the weeks come. And then I think the final area that I want to mention on the SNAP piece before ending with summary EBT is just the cost shift of SNAP, placing greater burdens on states. Because of all that happened during the shutdown, we anticipate states having to encounter greater error rates, and error rates will impact the cost of the program to the state. As I've shared in past briefings, the federal government always used to pay for the SNAP benefit, but now, as of just after the midterms, it'll go into effect where states will have to pay a portion of the SNAP benefit. And if you go to the next slide, that's just a quick review of what this could look like for Tennessee. It's all based on issues that pop up, either SNAP caseworkers making errors or people who apply and make errors. It has nothing to do with fraud. It doesn't measure fraud. And it's really looking at errors that are created. And because of all the tumult that's happening around the SNAP program, we're seeing more issues pop up with the program. Tennessee has had issues with error rates in the past. In 2023, we had an 11.54 error rate, which would end up costing the state $242 million. that's the amount that we would have to pay in SNAP benefits. In 2024, we got that error rate down, but all that's happening is not going to help make that error rate lower. So we will talk more about this. I think it's really important that our state legislature and officials at the state level understand what this cost is so that they can push back on the federal level. There are efforts to urge the federal government to postpone these error rates. There's a really unfair practice going on right now where just one or two states who have an extremely high error rate is being absolved of having to pay anything. And so there's definitely some problems with the approach to making states pay for SNAP benefits. So we'll talk more about that in the next briefing. The piece that I want to end on that I think is really important because the time is ticking is the next slide and talking about summer EBT. For folks who've been following us in the past and have connected with us on summer EBT, this is a benefit that's been extremely helpful to families during the summertime. Summertime is always a challenging time for low-income families, especially low-income families with children. And with grocery prices at an all-time high, we've heard from multiple families who've told us, well, my SNAP benefits have lapsed, but at least I had summer EBT, or I'm not eligible for SNAP and summer EBT is the one program that could help me. In 2024, we served 700,000 kids. It brought in $80 million to Tennessee families, which went direct into the economy. And we really want to see that program back. The governor has until December 31st to opt into this program. And we would like to see that happen for 2026. Most states in the South, as well as across the country, have decided to operate this program. Many of our neighbors around us, Alabama, Arkansas, Kansas, Kentucky, Missouri, North Carolina, Virginia, and North Carolina are all participating. So we'd like to see the same for Tennessee. The next slide has a map, and we've heard from families across the state who have shared what this means for them and how important it's been. And we are still collecting stories here. And our ask for today is for folks on the line to weigh in on summer EBT. And I think that's the next slide is just where you can click to ask the governor and the commissioner and state legislature to push for summer EBT. That's what I have for today, and I'll be on the line for questions if folks have any.
Thank you so much, Signe. And before we pass it over to Jane, I just want to remind everyone that if you do have a question, please go ahead and put it in the box, in the QA box, and I've given instructions in the chat. But I will pass it right over to you, Jane.
Thanks, Danielle. And thank you again, everyone, for joining another one of these calls. We're coming up on one calendar year of us having briefings, and we continue to have a lot to report on both the health and nutrition side. So I'm going to go through some updates on the health side. We are seeing not as much implementation of HR1, but still a lot of conversations around enhanced premium tax credits. Next slide, please. So, like I said, what has set up the current political moment really started a year ago with the election and a lot of threats to healthcare access, not only through Medicaid, which was heavily impacted by the bill that passed over the summer, but also the enhanced premium tax credits as they are set to expire at the end of this year. So the enhanced premium tax credit debate that we've been talking about for months and months and months has become kind of a political foreground for the upcoming midterm elections. And what we're seeing is that there's a political battle that's really centered on the affordability of health coverage. And so there's a lot of conversation both on the Democrat and Republican side about the stakes of health coverage, and on the Democrat side, pushing for the extension of enhanced premium tax credits, and on the Republican side, opposing those credits, but still wanting to provide a solution to healthcare affordability, because that is just the conversation for everyone's constituents right now. So no matter what side you're on or what you work on, the conversation around healthcare affordability is pretty unavoidable. And so we're just going to give you the information you need to kind of participate in those conversations and understand what the developments are. So moving on to the next slide. So, like I referred to earlier, the healthcare subsidies are making headlines. I'm going to be using the term healthcare subsidies interchangeably with enhanced premium tax credits, or EPTCs, because we see these referenced very differently in the media. So, just to make sure everyone knows that we're talking about the same thing when we're saying Obamacare tax credits, healthcare subsidies, tax subsidies, EPTCs, we're talking about the same thing, which is what benefits make the ACA marketplace, the Affordable Care Act marketplace, affordable, actually affordable. So the deal right now is open enrollment has started. So with the marketplace, if you want to enroll, you have a set period for the vast majority of people. You have a set period from November 15th until December 15th if you want your enrollment to start January 1st of the next year. If you enroll after December 15th, it's not a closed door. You can still enroll, but your enrollment period just starts later. So, as of November 15th, this is while the shutdown conversation was really looming, a lot of people were seeking out resources to enroll in the marketplace because it's open enrollment period, and they were seeing the quotes for their enrollment for their premiums, and they were seeing numbers that were either higher than they expected as new people joining the marketplace, or higher than they paid last year if they were trying to re-enroll and renew their enrollment for the next year. And people have been making a lot of noise about this. There's a lot of frustration about doubling premiums, extremely high costs that don't look like what people have been paying for the last 4 years. So some of that led to a blue wave of election outcomes in recent months, which were favoring Democrats who were platforming healthcare as the healthcare affordability crisis. This is really, again, regardless of how you vote, this is really important because it's put a lot of pressure on the Republican Party to respond. So now we're seeing a bit of a volley between the two parties on how to respond to the healthcare affordability crisis, and there's no longer a denial that there is a healthcare affordability crisis. So we've really changed the Overton window, so to speak, in the last few months about access to healthcare, who needs healthcare, how many people rely on the marketplace for healthcare, and that's been net positive. That's been a good thing because now we have everybody paying attention to access to healthcare. Right now it's on the marketplace, but it could very easily be back on Medicaid in a few months. So we just need to keep that pressure and attention up. This attention is coming from us, from advocates, from you all as individuals. It's coming from the media. It's coming from Congress. There's just so much attention and conversation about um, what people might be experiencing in starting January if these tax credits are not extended. So just to reiterate, the extreme pressure that Democrats and Republicans are facing to solve this problem, because all of their constituents are asking the same questions. What will my healthcare look like next year and the years after? So we'll talk a lot about what the alternative proposals are, but really refocusing that the key right now is just to keep the pressure up, keep the conversation going, because we now can say for certain the attention that we've been paying to tax credits in the marketplace has paid off in making this a national priority. So let's see what we can do with the continued pressure. And on to the next slide, please. So the state of the healthcare fight, as Signe referred to the government shutdown, which is over after 43 days, but still has kind of set us up for the current political moment. The continuing resolution that ultimately funded the government in November did not extend the premium tax credits, right? We know that. But the Senate had promised to hold a vote in December about extending those tax credits, and that would require bipartisan negotiations if there's going to be any progress. So we are in December, and so we have an update as of Monday that the Senate is expected to hold this vote, this promised vote, this big vote that has been kind of looming since mid-November. It's now supposed to be next week. So we can by the end of next week, there should be a vote in the Senate about extending the healthcare subsidies. There are bipartisan negotiations that are ongoing. There is not going to be any progress without bipartisan support. This has been acknowledged by parties on all by individuals on at and all parties on both sides. And so we're just kind of following that conversation. There's a lot of nitty-gritty details that are being released. There are a couple of whisper channels, there's some reporting. This senator is proposing this, and this representative is proposing that. But really, we don't know. There's a lot of confusion about what might be successful, what might get votes, what might be too alienating for certain individuals. And so I would encourage folks not to worry too much about the meat of any particular proposals, unless that's your thing and you just like to get into the nitty-gritty. But what we need to know is the debates are really centered around either extending the tax credits or what alternatives might be available instead of tax credits, and really one way or another trying to respond to the healthcare affordability crisis. So there are no Republicans that are voted to support the extension of the tax credits. In fact, many of them are opposed. But we've seen again with the pressure from recent elections, they have been caving to the idea of tax credits, maybe just limiting them for a few years, or maybe other compromises like stricter income caps and other eligibility restrictions. So nobody's committed to vote in support of an extension, but everyone is paying attention and willing to negotiate around that. Which we already knew, but again, with the increased coverage, it's really important to keep highlighting how many people are being convinced and brought over to the side of these tax credits, at least in some form. There was initially no vote to hold no commitment to hold a vote in the House of Representatives. Again, in the continuing resolution agreement that funded the government, the vote was promised in the Senate, not necessarily the House. So we didn't have a commitment that there would be a vote in the House, although that was kind of expected. Now that's unavoidable because the same pressure that senators are hearing around the tax credits representatives are too. So there are numerous council meetings and presentations and dealings among representatives who want to propose an alternative to the tax credits, or are clearly in support of extending those tax credits. And then, of course, given the political landscape, whatever ultimate package is decided needs to be approved by President Trump. And so that is kind of the background here. So as these negotiations are moving forward, we hear a lot about what may or may not align with the administration's agenda. And so we just have to keep that in mind as politicians are negotiating in Congress. Next slide, please. So, like I said, what's really been getting a lot of attention right now are these alternate proposals from the Republican Party. Democrats are pretty straightforward. We as Democrats want the extension of the enhanced premium tax credits. That is the party line by and large, and that is what they are putting forward as what their voters want. On the Republican side, they see it as not politically expedient to extend the enhanced premium tax credits because the goal is, or it's seen as just the kind of government spending that they might not support. But like I said, they can't leave the healthcare affordability question unanswered. And so the alternative proposals are really revolving around what are called health savings accounts. Well, we talked about this a little bit last week if you're new to the idea of health savings accounts or HSAs, and I'll talk about it again today and give you all more information. But really, this is what's grabbing the headlines now. So the proposals, both in the House and the Senate, are revolving around healthcare savings accounts, which is a priority of the current administration, which is to say, instead of funding the premium tax credits that would decrease how much people pay every month, let's fund their health savings account and give them this kind of separate uh, pool of money they can use for certain out-of-pocket healthcare costs. It's seen as a way to more directly benefit the consumers and the individuals who might need or might have healthcare costs. But as we'll talk about, there are severe limitations to HSAs. So we've seen, you'll see a couple of senator names and representative names bouncing around as proponents of these healthcare savings account plans. And as you kind of read through them again, they'll change by the end of this week, and they'll change even more by the middle and end of next week when votes are expected. But it's interesting to see the focus on putting money in these HSAs and having that be a pathway to healthcare affordability, in contrast to the premium tax credits that people have relied on in recent years. So, of course, there are people who support HSAs, and so we'll just share some information about, again, those limitations and then contrast them with tax credits that we all kind of are familiar with as the norm today. So, House Speaker Mike Johnson recently promised that there would be a blueprint released in the coming days from the House, but there's really a question of time here. The House is going to be on recess as of December 18th, and so that is not as much time for, again, negotiations, for drafting, and just the general compromises that have to be made within and across party lines. And so we're going to see a lot of news emerge rapidly in the next 2 weeks, and not all of it will be long lasting. We might see things that just kind of don't go anywhere, but there's a lot to keep track of. So this is just a way to refocus. And again, the top line is health savings accounts. And what we're going to do is talk about why that's not enough. Next slide, please. So, health savings accounts are a way for people to fund out-of-pocket health expenses, but the key point is you cannot pay your premiums using HSAs. So, if you have we've done the math before a couple of times, and we'll see an example. If you have, your premium costs about $400, and with the enhanced premium tax credits with the subsidies, you're paying more like 180. If you have if these tax credits expire, your monthly bill goes back up to that $400-ish amount. If you have an HSA, that's helpful if you need some medical equipment, or if you need, so if there are certain things that you need related to your healthcare, but they don't reduce your monthly burden for for your healthcare premium. So a lot of people just need to look at what their biggest expense is, and a lot of times it is that premium, and keeping that premium low is the reason they're even going to commit to getting health insurance, because if their premiums are too high, they might just opt out of the marketplace, whether they have those out-of-pocket health expense funds or not. So that's one major part of it. Another part of it is the other than it not being other than HSA funds not going towards your premium, is a lot of people just can't afford to dump as much money in there. They're just not making enough money to build an HSA fund that has enough money to actually respond to the average cost of medical expenses. You can have a routine medical procedure or a hospital visit that costs over $1,000. And right then there, that's who knows how long it took you to save that up in your HSA. So again, premiums are the baseline that make healthcare affordable for people to even enter into having health insurance. Talk less of having an HSA fund that they can then pull from in if they have an emergency. So it's not a replacement for premiums. It's subpar, and it's something that a lot of people just simply cannot prioritize financially. So we have some numbers here around HSA. So most people in the marketplace are making around $47,000 a year. That is that at that income bracket, that's not you don't really have the opportunity to contribute money to your HSA, because you're going to need that money to pay your bills month to month. So the lack of spare cash available to really fund these HSAs, and the fact that they don't actually reduce the monthly cost that people have to bear, which could be in the hundreds, and for some people thousands, really make clear that they're not a favorable way to address the healthcare affordability crisis. They are only going to create problems down the line, and they're going to lead to people opting out of the marketplace. Because again, the first thing people ask is premiums. They're not really looking at their HSAs when they're thinking about whether to get insurance or not. So, yeah, just to reiterate, HSA proposals do not go far enough to fix the issue of potentially doubling premiums for many, many people, that's the risk. So, coming January, people are looking at uh, double whatever the monthly premium they were paying in 2020, this year in 2025. Next slide, please. So, what does that all mean for you guys? That just means keep up the pressure. We've used these briefings to connect you all to the most up-to-date political information and advocacy information, which has been really critical to get the word out about these EBTCs, these healthcare subsidies. And the key point is this pressure that we've been building is the reason that there are compromises being made around healthcare affordability. And the reason that now the moderate position on the Republican side is maybe we can extend the tax credits for a year or two and also fund HSAs. So the conversation has gone from no extension to, well, let's see what we can do. Because you as constituents and we as constituents have all used our time and our voices to make it clear that the priority coming up in 2026 is healthcare affordability, and that is the key. So keep taking action through TJC and other means to let your representatives know that we all need these tax credits enhanced. The healthcare system broadly, whether you use the marketplace, you have private healthcare, you have Medicaid, they're all connected as the same insurance companies. And if that insurance pool goes down, healthcare costs go up for everybody. So nobody can afford more expensive healthcare. People can barely afford healthcare as it is right now. Again, Democrats have not really wavered on their demand for the extension. So whoever your constituents, your representatives and senators are, let them know like the pressure is working if they are putting pressure on to extend these credits. And if they oppose the extension, put pressure on them to support the extension and to support the extension and to compromise, which is really what everyone needs to do right now. Like I said, all of you as constituents want affordable health care, so keep the message consistent, keep the message clear, especially going now into the end of the month and the deadline for the promised vote on this extension in the Senate, and then we'll see what happens in the House. So reach out to your senators, reach out to your representatives, and just keep that conversation going. Next slide, please. And we shared this before, but I want to make sure that everyone has an example when they're reaching out or when they're kind of reconciling these updates that we're sharing. The reality for many, for this is District 7 in Tennessee, which recently had an election just yesterday. I think the results were out as of this morning. An individual who has the premium tax credit enhancements is currently paying, 45-year-old individual is currently paying $691. Without these enhancements, starting in 2026, they're looking at paying $2,159. That is a huge increase in their annual expenditures for the family or for the household, and is not something to be taken lightly. So these numbers are extreme, but they are the reality. People are looking at the premium quotes that they're getting and making choices about whether to enroll in healthcare or not. If you want some of this information, you can go to our TJC website and you'll see stories of folks who are on the marketplace and have to make these choices and how they're approaching it. So please share your story if you or someone you know is on the marketplace. Share some of this data, share some of these numbers so that they know how your congressional senators or representatives know how dire this is, how severe it is, and make sure that you're consistent with your language. So altogether, I just can't say enough how critical it's been that we continue to have an audience of, over 100 people listen to us talk about tax credits and things that might not always seem so interesting, but have really made a difference in the national conversation. So we're at a critical point. We have a couple weeks to go, and we'll keep using this space to push you all towards taking action and having, of course, the most up-to-date information. I think that's about it for me on the health side. And so I will turn it back over to Danielle. But of course, during Q&A, we can hear more from you all.
Thank you so much, Jane. I am looking in the Q&A box right now, and we surprisingly don't have any questions. But that does not mean that as we're going forward, if you have any questions, please again feel free to drop them in the Q&A box. But if you're still mulling over a question or trying to figure out exactly what it is you want to say, no worries, because I can keep going and I'll stop if I see one in the chat. So as far as what to focus on now, again, as was said before, really urging Congressman to extend the enhanced premium tax credits. You can use the form that I put in the chat, which you'll also receive again once we send out the slides. And then you can also call Congress at this number that you see on your screen. As far as nutrition, again, as Signe said, contact Governor Lee, DHS Commissioner Carter, and your state legislators, urging them to opt into summer EBT for 2026. And then, as always, be a truth squad. So on social media, letters to the editor during this holiday season. If you are getting together with family, please be sure to push back on why all of this information that we've been telling you today is harmful, and urge them to contact their legislators as well. And then again, share your story with us, because stories do move hearts. Another thing that we have at the Tennessee Justice Center is we have a Protect and Care Medicaid coalition. So if some of the information that has been discussed today, it really grinds your gears, or you just would like to talk more about it, please, please, please feel free to join the coalition. It is a very welcoming and open environment. So even if you're just there to listen, we definitely encourage you to fill out the form to register. And then moving on, we wanted to share a story as well of someone who is currently receiving coverage from the marketplace. So this is Diana's story. Diana Wilson, 60 years old. She describes her current marketplace plan as the most wonderful insurance she's ever had. After years of running her own cleaning business and raising her children as a single mom, Diana now works part-time and enjoys spending time with her family. Her marketplace plan helps her manage several autoimmune disorders by keeping the cost of her medications, frequent specialist visits, and monthly infusions within reach. She says, having health insurance and knowing I can afford the medicines that keep me alive has made all the difference in the world. The tax credits I've gotten have probably saved my life and my children's lives. Honestly, affordable health insurance for people like me is a miracle in itself. These tax credits are the difference between putting extra food in your house and going hungry to pay for your health care. They give me peace of mind, and that's a small miracle. Beginning next month, Diana's monthly premium for the very same plan will unfortunately rise from $109 to $345. So moving forward, this is why it's super, super, super important to share your story so more people are able to understand exactly what things will look like on the SNAP side, on the nutrition side, but as well on the health side, as we are pushing for the extension of these enhanced premium tax credits. So there are 3 different ways that you can share your story. The first is you can use the online form as is linked here in what I'm also putting in the chat. And then you can also call and leave a voicemail at 615-241-9563 and leave a voicemail. It can be as long or as short as you would like. Or you can also email us at stories@tnjustice.org. Moving right along.
Danielle, can I jump in real quick?
Yes.
I just saw that there was something in the chat about summer EBT, and just wanted to address that real quick. There was a question about the cost to the state, and the benefit itself does not cost the state anything. So the $80,000 that came, $80 million that came to the state in 2024 was all direct from the federal government into the state. There is a small administrative cost that the state must front, but it's an equal share between the federal government and the state. And to Tennessee in 2024, it was around $5 million. And in 2024, it would have been even less. Just around $3 million is one of the quotes that came from DHS. And so it's a really small price to pay for families that would receive a significant support during the summertime. So just wanted to jump in there real quick and answer that.
Thank you so much for seeing that and for answering the question, Signe. Going to our call to action, as always, please register to vote if you have not, and exercise that right to vote whenever you can, especially for those folks who are in District 7. I hope that you were able to exercise that right yesterday and during early voting period. And then also follow TJC to stay on top of the information that we're sharing with you today. We typically share information that we are just finding out, or just in time information, I should say, on our socials. So make sure that you are following us on there. And then as well, stay informed. You can sign up for plenty of our newsletters as well, which is where we share a lot of information that we shared today and so much more. And you can do that as well through the links that I'm putting in the chat. And then also, again, once you get these slides. All right. And again, Wednesday briefings, they are now moving weekly. And so we will see you all back here December 10th next week. Super excited again for that. If you have any questions, please feel free to contact us as always. And then before you leave, if you can please take a moment to fill out our feedback form so we can make sure that we are giving you the best experience as far as receiving this information. But as always, thank you for joining us, and I hope you all have a great rest of your week. Bye-bye.